So the Nursing and Midwifery Council is the regulator of nurses and midwives in the UK and nursing associates in England. And my role there is predominantly for education and standards, but also to advise the whole organisation on midwifery matters. Next slide, please. Next year, I'm going to be celebrating 40 years as a midwife. I can't believe how quickly that time has gone. It seems only yesterday when I was sitting my midwifery viva, which was what you did in those days, being asked quite stiff questions about my knowledge and skills. And a lot has happened and a lot has changed since I qualified, but I have to say that my commitment and my passion for midwifery remains still today. It would be very difficult to choose a highlight. I had great fun putting this slide together, and I hope it's making you giggle as well, because we no longer wear hats and we no longer sit in rows being taught. We're still with our uniform on. But I've been so fortunate. I've had a very varied career. I've worked as a midwife in a variety of settings, clinical, in the military. I've worked overseas in Germany and Saudi Arabia. I've done a lot of work in midwifery education as a lecturer, and I still practice clinically and today to ensure that I never lose sight of why I became a midwife, and importantly the needs of women and babies, so that in my current role I can have an authentic voice when I'm talking about midwifery matters. Now, I first became a nurse. That was the sort of the traditional route in those days, and you can still do that even today. And it was probably during my placement on a maternity unit, during my nurse's training, that I realised I wanted to be a midwife. And I had to do the whole 3 years. Training to be an adult nurse, then I had to do a little bit of post-registration practice, and then I did a 1-year midwifery programme, and I've been a midwife ever since. But I think it's important just to say at this point, you can't practice as a midwife in the UK, or indeed call yourself a midwife, unless you are registered with the Nursing and Midwifery Council. So what is a midwife? Well, I've gone back to the Lancet series on midwifery, which was a quite important piece of work that was done recently. And midwifery is defined as skilled, knowledgeable and compassionate care for childbearing women, newborn infants and families across the continuum throughout pre-pregnancy, pregnancy, birth, postpartum and in the early weeks of life. And some of the core characteristics of that work is about optimizing normal physiological process. And what that means is trying to keep things where the woman is progressing well, and as does the baby, and not intervene unless it's absolutely a reason to do so. We also must think about, though, a woman's social context as well as their cultural needs. We must, importantly, as a midwife, ensure that while we're caring for women and families, that we're preventing things occurring and we have timely management when things are perhaps not going in a straightforward way. And importantly, we must think about the woman, about her particular individual choices and the views that she has. And one of the key roles for a midwife is to work in partnership with the woman and her family to strengthen their own capabilities in the care for themselves and their newborn baby. Now, a midwife is fully accountable, and what that means, they have to be able to justify their decisions, and they are the lead professional in care as they give that support to women and newborn infants and the whole family. And it's very important that they base their care on best evidence and keep up to date with their current knowledge and skills throughout their whole career. And midwives are ideally placed to anticipate and recognise when perhaps things are not going as they should do. And importantly, they will work with others to provide that additional care, whether that be an obstetrician or whether that be a social worker, health visitor, etc. They also are very, it's very important that midwives look after the mental health needs of women and their families, as well as their social needs, their cultural needs, and their spiritual needs. And occasionally, when things don't go well, they have to support that family when there's been a loss of a baby or there is end of life care. They have a big role in promoting public health, and it's a very unique opportunity to engage with the health services where perhaps a woman and a family have perhaps not had that opportunity before. So things like trying to encourage smoking cessation or adopting a healthier diet. These sort of things are really key to the midwife's role. And importantly, the women expect a midwife to be kind and compassionate in their care. So next slide, please. So how do you become a midwife? Well, we set those standards for that. And then we have approved organisations in the universities who are then able to deliver these programmes. And then at the end of those programmes, the midwife in order to practice. Next slide, please. The programmes are quite diverse and full, and there is lots of things happening in midwifery, some very exciting things in terms of how care is being delivered, providing continuity of schemes, etc. And the role of the midwife, I mentioned the Lancet series earlier, is very important because the care of women and babies the role of the midwife is to care for all of those women, even when there are some complications, and they then will guide and coordinate and lead that care along with those other healthcare professionals. But midwives also have to be aware of some things that are being challenging within midwifery at the moment. So this is why we have to be keeping up to date and make sure that where guidelines are developed, that those are also followed. Next slide, please. And internationally, the role of the midwife is becoming stronger. There's a recognition about the importance of the midwife to women's health and family health, and indeed where many countries don't really recognise the role of the midwife. I think as time goes by, particularly with this key document, which is talking about strengthening quality of midwifery education, that more countries will recognise and have midwives working in the way they do within the UK. Next slide, please. So, as you saw, my talk was entitled Midwifery, a Career That Can Transform Lives. So how do midwives do this? Well, they focus on those needs as well as those views and preferences, and importantly, the decisions of women and newborn infants. And sometimes those decisions we perhaps wouldn't advise that perhaps they were the best decisions, but they are the woman's decisions and their family, and it's important that we give them the accurate information so they can make their decisions and then continue to support them. Next slide, please. So they don't just support those physical needs, but those psychological needs, the social, the cultural and spiritual needs, and importantly, to keep women and newborn babies safe. Next slide. And midwives learn that pregnancy, labour and birth and postpartum and infant feeding and the early weeks of life do have an impact on the health and well-being of women and families. So all their work is about trying to promote that smooth transition and improve health and well-being going forward. So I said that there were different routes into midwifery, and the majority of students now study at our approved institutions, and they do a 3-year programme. And then at that point of registration, with us, they are able to practice as a midwife in the UK. But for another route still is where a nurse has has completed their programme as an adult nurse. They can also do a shortened programme, somewhere between 18 to 20 months. So there is still different routes. We now have routes through midwifery apprenticeships. And we also have master's programs for pre-registration as well. So a lot of universities now are widening their different routes into midwifery to give prospective students better choice. Next slide, please. So in the introduction, you were told about the fact that the 2020 is the year of the nurse and the midwife. And we were hoping this was going to be a year of celebration with lots of events, with conferences. We were going to have the International Confederation of Midwives conference, which brings midwives around the world in Bali. And of course, things have had to be put very much on hold. So in some respects, midwives have come into the lifeline, perhaps for reasons we hadn't really anticipated this year with the COVID pandemic. And midwives continue throughout this year to work extremely hard under challenging circumstances. Indeed, our students who've been on programmes have also worked very, very hard during this time in practice to continue to deliver the care. And things have had to change somewhat to keep everyone safe, but work has continued. We can't stop women having babies, so all of that care has had to be carried on, be delivered, and in some ways it's had to become more adaptable, and some things have had to change in the way we do things. We will continue to celebrate the Year of the Midwife next year, and hopefully in the way that we had anticipated. So just to conclude, I just really wanted to read something from the midwives from New Jersey. And I'm hoping this will just give you perhaps a bit of a sense of how privileged it is to be a midwife and how worthwhile it is. And it's called My Hands. These are my hands. Through these hands, I have come to see the world. These hands have measured the growth of life and documented the stalling of time. They guide my ears to places where you hear the watch-like beat of tiny hearts. My hands have felt the hard, bony framework of passages and softness of muscles, which will bulge like petals of a rose. My hands have opened windows to the energy of the souls of those I have touched. They have felt the frigid rigidity of steel instruments and the softness of a friend. There are stories in my hands, read from the pages of the work of women. With my hands, I have felt the power of the strength it takes to grow and release a new spirit. My hands were born with the knowing of touch. The journey has added the how and when and the time to ask for help. Teaching hands have engulfed mine until they were ready to fly. My hands are joined in a circle which is unbroken through time. Sometimes my hands do nothing. Their most important work will be still with fingers laced and witnessed. The art of doing nothing has been passed from one generation to the next. Mine have been taught by some of the most powerful hands to watch and wait. This is perhaps the hardest for hands born to touch. If I have nothing else to give you, let me teach you how to see with your hands, how to open the windows of life and close the door softly when it is time. In the darkness, it is your hands that will light the way. These are my hands. These are the hands of a midwife. Final slide, please. Thank you for listening. I'm delighted of those of you perhaps who are already considering a career in midwifery. My details are there if you wanted to learn more, and good luck on your journey to become midwives.